Lung cancer screening is important because if you are eligible for screening or if you have any of the risk factors, then catching it early is critical for your treatment. And it can really affect the way that your lung cancer journey goes. But it's also important to remember that most screenings do not catch anything. So you don't have to go in there with fear. It's like a simple thing. It's a low-dose CT with no needles or anything, just a quick 5-minute scan.
Much of Lung Cancer Foundation of America's focus on this World Lung Cancer Day is on those living with lung cancer. But as you know, or certainly can imagine, a cancer diagnosis really affects the whole family.
So now we want to take a moment and talk about caregiving. You know, a caregiver could be a spouse, a life partner, or a loved one. And we know that caregiving can be really rewarding, but you know, it can also be very daunting.
That's why LCFA devoted this year to a podcast episode about caregiving that offers firsthand advice on how to avoid becoming overwhelmed. Here's a glimpse of that Lung Cancer Foundation of America Hope with Answers podcast episode.
First of all, let me just tell all caregivers, remember that you do make a huge difference in your loved one's life by doing what you do, right? So your compassion and your dedication is just truly remarkable to be a caregiver. Some key takeaways though, self-care matters. So remember that you can't pour from an empty cup. Remember to take care of yourself and prioritize your own well-being as well while you're caring for your loved one. Communication is key. Communicating, keep the lines of communication open between you, your loved ones, and then other family members or the medical team. Share those responsibilities and decisions together. Make sure you educate yourself about your loved one's condition or disease. It's very important to understand what their specific needs will be as they go through treatment so that you can even provide better, care. Keeping organized is huge. Make sure that you have a central location, whether it be in writing or something where you're connecting with others that are helping with any care online, but just creating some kind of organizational plan for the caregiver and the patient. Super helpful.
Hi there, Frank and Debbie. And Frank, you're a personal trainer and you're used to being in top physical shape. How difficult was it for you to have to ask Debbie for help on things early on when you were first diagnosed?
Yeah, it was difficult because, as you said, being a personal trainer, and at the time I was teaching and had my personal training business. So I was pretty independent to work 2 different jobs, to train myself, training other clients. And when I was, shocked by my stage 4 lung cancer diagnosis, we didn't know anything about it. And when my first targeted therapy didn't work, that is when, I really, when you go through the shock, you rely on, the person that's with you, your caregiver or your spouse, whoever that close person is with you, to kind of, go through everything with you, the appointments and different things like that.
I just happen to have had a friend go through the same kind of thing like 9 months before Frank was diagnosed. And she told me the way she coped was to keep herself busy. And so she started painting every wall in her house while her husband was going through all this stuff. So the minute I found out Frank was very sick, I went outside and started painting our pagoda. I mean, I just thought, fine, he went off to work, but I was like, I got to start painting. This is going to be stressful.
Make sure that you embrace respite time. Again, going back, to the self-care. Take those breaks to recharge, because there's so many times where as a caregiver, you're going to feel very overwhelmed and unsure of, are you doing the right thing? What does my loved one need, etc. So just make sure that you're taking care of you at the same time. There's always professional help if that's needed for someone. And I think that's always a good thing, because we don't want a burnout, of course, right, for the caregiver, but we also want to make sure that they are taking care of their, especially the mental well-being, physical well-being, of course, but the mental piece of this whole process and everything that you're willing to do for your loved one, it can take a real toll. So we don't want to forget or minimize the effect that it can have on that caregiver.